Okay, I think, what are we on now? 5? Video 5? 1, 2, 3, 4, 5. I think we're on 5. All right. So this will be a pretty short one. We're just gonna go through some pearls and talk about references they use, and you're gonna be doing this throughout this class and this semester. I'm sure Dr. Mosler will have a lot more to say about these things throughout the class. I'm not an expert in this, but I just wanted to kind of, as a completeness thing, go over it. So again, things to worry about, things that should be at top of mind: anticoagulants, psychotropics, antimicrobials, vancomycin, analgesics, NSAIDs. So these are all commonly used in this population. Anticoagulants, due to decreased renal clearance, you're going to see an increase in exposure. You're going to want to use Cockcroft Galt for those that are cleared renally. Also remember there's an enhanced pharmacodynamic response, so they're more sensitive to anticoagulants. So your goal range may be lower. Psychotropics. Remember, we want to avoid long-acting benzodiazepines and try to stick to lot, right? Lorazepam, oxazepam, and temazepam if you need a benzodiazepine. You want to monitor for hyponatremia and bleeding in some of these, and hyponatremia, it can be a killer in this population. Antimicrobials, aminoglycosides will have a decrease in volume distribution and a decreased clearance. Remember, they're totally renally cleared, and they are mostly in water. It's a hydrophilic drug. So remember, we have less water, so we'll have a smaller volume of distribution and a decrease in clearance. So you might not see a big difference in half-life, but you're going to want to decrease the dose and note that the volume of distribution is smaller, so you might give a smaller loading dose. Vancomycin specifically, we get better results with area under the curve guided dosing rather than concentration guided dosing. Analgesics, there's an increased sensitivity to opioids. Be careful with opioids. NSAIDs, we want to avoid chronic use because of all the problems we talked about a minute ago in the last slide. That they interact with a lot of other drugs and diseases, and it's mostly renally based, that it can enhance a decreased renal function. There's lots of guides that can help you choose specific information for the geriatric population. Use that information. There's no need to reinvent the wheel. Make sure you're using all your resources to get the most up-to-date information on how you should be dosing your geriatric patients. Here's using Beers criteria, which I'm sure you're going to be studying, and stop-start criterion to help you to make decisions about this age group. So just as an overview, the Beers versus stop. Beers is done by the American Geriatric Society, so it's US based versus a European origin for the stop start. Focus for the Beers criteria are drugs to avoid. Stop start gives you drugs to avoid and initiate. You can remember that by the stop and start. So it's not just what to avoid, but what are drugs that are better to use in this group. How is it organized? By condition and risk type, and stop start is by organ system. Beers criteria emphasizes drug names and interactions, and stop start emphasizes the focus on clinical appropriateness. Beers are usually used for outpatient US population, whereas stop start is really for all, both hospital and long-term, as well as community settings. Beers criteria is best used for screening and trying to stop drugs in this population, whereas stop start is a little more comprehensive on how to improve all medication, not just stopping, again, not just drugs to avoid, but more comprehensive approach. The strength for Beers is it's easy to, it's straightforward, simplified, and a lot of EHRs have it integrated right into the system. The strength of stop start is it's more comprehensive as far as both avoiding and initiating, and can include not only overprescribing, but underprescribing. Limitation for beers is there's no positive prescribing. That's a common theme, right? It doesn't really help you in what you should give, just what you shouldn't give. And stop start is a little more complex, a little more comprehensive. All right, next video, we'll do some cases. Thanks.